where the experts meet. Online learning, practical and sweet. Every Saturday, 9 a.m. Central Time. YouTube, Facebook, X, and LinkedIn. Online.
Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Senese. Glad to have everybody on board today. Hey, if you're watching us, be sure to like and subscribe. You guys have been burning it up. We're over 5,000 subscribers and growing, so keep doing the great job you're doing. So today's episode, what are we going to talk about today? Well, I'm going to present a topic that, believe it or not, we've never talked about. Varicoceles, how to treat them, how they can improve things like fertility, testosterone results, and pain relief even. So I'm going to get into that in just a moment. Interestingly, we just got back from vacation with my wife and I a couple of days. We're gone touring Madison, Indiana. Neat place to check out. Now, one of the things that we were talking about in that long car ride was how long UroNurse has been. And we figured out we're going on almost onto our 4th year. Pretty good. So this is episode 193. Never missed an episode. Don't plan to miss an episode. So let's get right to it. I'm going to switch this over and hang on one second as I make it over to my slides. Okay, where are my slides? All righty. Well, I don't have my slides, so we're going to add those slides in here right now. Okay, so now you should be looking at my slides. Sorry about that, folks. Until I started pushing some buttons, everything was working perfect, but oh well, you know how things go. All righty, so I've got my slides up here. And you should be hearing me. If there's any questions or problems hearing me, be sure to throw it into the comments because I can't tell. I'm monitoring the show. So now we got our slides. I can see I'm up there on screen. So today, as I said, we're talking about a common condition, often overlooked, but it's the simple varicocele. What is it? Let's get into it here. So a varicocele often feels like a dull, aching discomfort or sense of heaviness in the scrotum, especially after standing for long periods or the end of the day. Some patients describe it as a dragging sensation or mild throbbing that improves when lying down. You may notice an enlarged or twisted veins that people describe as feeling like a bag of worms above the testicle. In many cases, a varicocele causes little or no pain at all and can be found just incidentally. If discomfort becomes persistent, worsens, or is associated with swelling or changes in testicle size, that's when it's important for patients to seek a medical evaluation. So let's talk about that bag of worms that I described. If you can imagine that, that's kind of what they feel like. If you're doing a physical exam and you're grabbing onto the testicle and feeling around there, right above it, you're going to feel something that feels like that. And this is kind of a better picture of what those tortuous, like a varicose vein in your legs. This is just that it's in the scrotum, and you can kind of see some of those, and that's what it's going to feel like. Once you felt it, you're going to agree it feels like a bag of worms. I've done enough exams to know. So let's see, what is that bag of worms really about? So a varicocele is an enlargement of the veins that carry oxygen-depleted blood away from your testicle. It happens when blood pools in these veins instead of circulating efficiently. Varicocele is more commonly found on the left side because of differences in how the vein drains from each testicle. The left testicular vein travels a longer path and drains into a larger vein, the left renal vein, at a right angle, which can create higher pressure and slower blood flow. In contrast, the right testicular vein drains more directly into the inferior vena cava with less resistance. This anatomical setup makes it easier for blood to pool on the left side, leading to that vein enlargement and development of varicocele. And this is kind of our normal view right over here, and then we get over here and we see that bag of worms, that collection of distended veins. So how common is this? Well, it's pretty common, affecting about 15% of men overall. So, it's not very common, but common enough. The prevalence increases in certain groups, occurring in up to 35 to 40% of men evaluated for primary infertility. Aha, now there's the key. And as high as 70 to 80% in men with secondary infertility. So somebody comes in with infertility, you ought to be checking for that, right? Varicoceles are the most often diagnosed. No, I'm sorry. Varicoceles are most often diagnosed during adolescence or early adulthood and are significantly more common on the left side, as I mentioned before, because of those vascular reasons. About 80 to 90%. Despite how common they are, most varicoceles cause no symptoms and do not require treatment unless they are associated with pain, testicular changes, or fertility concerns. And we'll talk a little more about that. So here's why it happens to affect all this. A varicocele can act like a heat trap around the testicle. We kind of see the normal, and we've got all this big bloody, blood pumping through here. It's going to cause higher heat. Normally, the veins in the scrotum help cool the blood before it reaches the testicle, which is important because the sperm production requires a slightly lower temperature than the rest of your body. So we all know body temperature should be 37 degrees Celsius or 98.6 if you're using the Fahrenheit scale. And by our maker hanging the testicles down in the scrotum, it helps them to be a little bit cooler. And actually, inside the scrotum, it should be about 2 to 3 degrees cooler centigrade, 3 to 5 Fahrenheit. So around 34 to 35 degrees centigrade and 93 to 95 Fahrenheit. I include both because I know our show gets out around the whole world, and some people are using the Fahrenheit, some are using centigrade. So anyway, it's going to keep it slightly cooler. And that's very important when it comes to things like, as it's too warm or coming up to body temperature, some oxidative stress. Now, a varicocele can affect fertility and testosterone levels by disrupting the normal environment of the testicle. The enlarged veins can cause increased heat and poor blood flow, which may impair sperm production. So we kind of see good normal production. Now we start heating it up, it drops. Lower sperm counts, lower motility, abnormal shapes, all that stuff. Over time, the same process can also impact the cells responsible for producing testosterone. So men coming in with low testosterone, you need to check them for this too, potentially leading to lower hormone levels in some men. Well, not every varicocele causes these problems. That's key. It is an important potentially, now here's the real key, it's potentially a reversible factor in men being evaluated for infertility or symptoms of low testosterone. And we can see, as this shows here on the testosterone side, it affects those Leydig cells. When you start heating them up, you get low testosterone, which can lead to things like fatigue and lower libido. Now, a varicocele, 3 simple, non-invasive steps to define your diagnosis, to get your definite diagnosis. So a varicocele is typically evaluated by using a simple, non-invasive method. Most often, healthcare providers like you and me can detect it during a physical exam by having somebody stand and performing a gentle bearing down maneuver to make the veins more noticeable. We call that a Valsalva maneuver, as we talk about right there. If confirmation is needed, then a scrotal ultrasound, the most common test, is used. It uses sound waves, no radiations, to visualize the veins, measure their size, and assess the blood flow. All these tests are painless and confirm the diagnosis. So real cheap physical exam, just feel for that bag of worms. You feel it, probably want to confirm it with an ultrasound. We'll talk a little more about that since I did a lot of those in my career. Now, let's discuss the Valsalva maneuver. Some people are confused by that. It's a simple and safe technique, again, used during the evaluation of a varicocele to make the veins more visible. It involves taking a breath, gently bearing down like you're trying to exhale with your mouth closed or having a bowel movement. You're increasing that abdominal pressure. This temporarily increases pressure in the abdomen, which can cause those enlarged veins in a varicocele to become more prominent, making them easier for your healthcare provider to detect during a physical exam. May feel a little unusual, but it's a quick, painless, and commonly used medical assessment. Now, you want to do that standing up too, because you want that dependent drainage to affect it too. So let's talk a little bit about the evaluation. And I mentioned ultrasound. So that's one of the tests that we're lucky enough in our office to have our own ultrasound machine. Many urologists do. And you can go ahead and do this test. Now, you can see we're ultrasounding the testicles. This is a laying down. I would never do that in that position. I always have the patient standing up, and I can bring the probe. I can kind of feel with my hand for the bag of worms and bring my probe right on top of it. And this is what the ultrasound picture looks like. So up here is the testicle. We can see that right there, very normal looking testicle. And now these are those distended veins. This is your varicocele. You can imagine why it feels like a bag of worms. It almost looks like a bag of worms, doesn't it? So that's what the ultrasound looks like. And when you have the patient Valsalva, you'll see these things, expanding in size. So this is after a Valsalva maneuver. Definitely want the combination. Not painful at all for the patient. So when does it require treatment? I like this little breakdown where subclinical varicoceles only seen on ultrasound but not felt, or normal semen parameters and no pain. Observation is okay and can be monitored with things like a semen analysis. Under these things, we recommend treatment. You're actively trying to conceive, your partner has normal fertility, you have abnormal semen analysis, you experience chronic or daily scrotal pain, or have a low testosterone. You should seek evaluation for any of those. If you notice a change in the testicle size, especially shrinking, that can also be a sign of a varicocele. And again, that concerns about fertility. Now, that's unlike if you feel a lump in your testicle. That could be something more serious, like even a cancer, sudden swelling, a lump, things like that. You want to have that checked out. Now, most varicoceles are harmless and do not require treatment. Your healthcare provider should be, checked into to be sure, especially if you're having reproductive issues. Now, how do we treat this? When treatment for a varicocele are needed, we have two common options. One is the microsurgery, and the other is the embolization. Now, microsurgery is a minor surgical procedure performed through a small incision in the groin using a microscope to precisely tie off the affected veins while preserving important structures. It has a high success rate, low recurrence. Embolization, on the other hand, is a minimally invasive procedure done by an interventional radiologist, where a small catheter is inserted into the vein and coils or solution are used to block the problematic veins from inside. No incision required. Both are effective, and your choice depends on your anatomy, your symptoms, and your expertise, your provider's expertise. I can tell you for our particular practice, we did not do the embolizations. We referred them off for that. We did microsurgical repairs. And kind of a couple of things that we liked is when you look at the rates, the spontaneous pregnancy rate, 44 versus 33. So it's your better shot. And recurrence rate is the lowest, 0 to 3%, where the embolization has a 15 to 25%. So, again, depends on your expertise of your urologist in your office. So after the treatment, a varicocele, for many patients, experience what can feel like a system-wide reset because normal blood flow and temperature control are restored. By eliminating the pooling of warm blood, the testicle can return to a healthier environment, which may improve sperm production, quality, and in some cases, testosterone levels over time. Now, this process isn't going to be instant. It's not like you're flipping a switch. Changes typically occur over several months. But for many men, restoring proper circulation helps the body rebalance and function more efficiently. Another good reason for having that fixed. After repair of a varicocele, some patients notice an improvement in fertility outcomes and feel what we consider the pregnancy bump in success rates. We can see couples are 1.82 times more likely to achieve pregnancy after a male partner undergoes a varicocele repair. That's a pretty good bump. And this is because restoring normal blood flow and reducing excess heat around the testicles will improve sperm count, sperm movement, and quality over time. In couples where a varicocele was contributed to infertilities, these improvements increase their chances of natural conception. And, when you look at the cost of all these artificial ways of conceiving, varicocele is a pretty inexpensive way. While results vary, many men see measurable semen improvement within 3 to 6 months after repair, which aligns with the timeline of new sperm development. Remember that. Live birth success. I like this one too. 2.80 times. The odds of a successful live birth increase by 300% after treatment, significantly outperforming those who leave their varicoceles untreated. So, after the repair of a varicocele, studies show that testosterone levels also can improve in a significant number of men, though the exact percentage varies depending on your age, the severity, and baseline hormone levels. On average, 60 to 80% of men experience either stabilization or an increase in testosterone after treatment, with many seeing modest but meaningful rises over several months as the testicle recovers its normal function. That's pretty darn good. The improvement is not immediate. It typically develops gradually over 3 to 6 months and tends to be the most noticeable in men who had a lower testosterone level before the repair. Now, here's the other thing we talked about. Improvement in sperm quality are usually seen within 3 months. We can kind of see this line here as the biological healing takes place. With more significant fertility and hormonal changes often seen 3 to 6 months later, in some cases up to a year. Healing varies from person to person, but the overall trend is steady, progressive improvement rather than immediate change. Now, varicocele is a treatable condition, and many men experience meaningful improvements in both fertility and testosterone levels after appropriate measure. And as we mentioned, also pain, some of these bulging and heaviness in the scrotum will go away. Now, when the abnormal veins are repaired or managed, blood flow and testicular temperature regulation improves, which may support this better sperm production and overall testicular function. Because symptoms and impact can vary widely from person to person, it's important to see a qualified specialist, generally a urologist, for an accurate diagnosis and personalized treatment plan. Early evaluation can help determine whether observation or intervention is best approach for your patient's situation. And as I said, I did a lot of these scrotal ultrasounds for our practice because I specialized in ultrasonography. And it was really kind of a nice thing when you see these patients come back and they tell you, hey, my wife's pregnant. That's really satisfying in your career. All right, so let's get back to our regular scheduled program. And there I am. All right. So that's everything you wanted to know about varicocele repair. Hopefully that I covered everything. If anybody has any questions in the audience, go ahead and put those into the comments. I'll be glad to answer those. Right now, all I got was a good morning from Katie in sunny Illinois. I'm in sunny Indiana. I can tell you, it looks like it's going to be a beautiful day. I was talking about that vacation. Boy, sometimes you just get lucky. We were out in Madison. I live in Indiana, closer to Chicago. Madison is south of Indianapolis, and it was significantly warmer there. I mean, we were almost flirting with 80 degrees. It was up in the 70s. And it was just absolutely gorgeous. And we were walking around the town and looking at all the great sights that there was to see. So, hey, if you're ever looking for a quick 1-day trip you want to do, that's a fun place to visit. There was a show I didn't even know that friend actor that I kind of like, Caviezel, was in, and it was called Madison. It was after the hydroplane boat called the Madison, and it was pretty good. I didn't see the show, but we watched it that night when we were staying in our Verbo, and all the things that we saw in the city, we would see all these things showing up in the movie. So it was kind of neat to see that combination. But anyway, fun place to go. So I don't see any questions. I'm good with that. That means that you guys got everything you needed to know about the subject of varicoceles, and kind of fun. Like I said, sometimes, we were talking about 4 years of UroNurse, and it's hard to believe that there's subjects out there that we haven't talked about. So we're always looking at new and interesting things to talk about. And I've got a bunch of things that I've recently are working on getting speakers because they're new. One thing I always said that's neat about urology is such a technologically advanced, advancing practice. There are always something new coming along, new treatments, new medications, new procedures. It's crazy trying to keep up with sometimes. So, hey, if you want to hang on, come back at 10:30. I'm going to be doing Euro patient. You must also, if you're, especially if you're a patient and you're watching this, that's a great one for people that want to know more about the gold standard for prostate obstruction, that TURP. We're going to have a little discussion on that. And join us again next week. I've got a great show coming up, and here's what's coming up next week.
Male enhancement is at an all-time high, but so are botched procedures and avoidable pain. Many men assume these treatments are safe, standardized, and painless. But the reality is that most clinics fail to prioritize patient comfort and long-term health. Dr. Pash will provide an essential guide to avoiding dangerous procedures. Join us on April 18th at 9 a.m. Central Time to learn more.
Yeah, that should be a fun episode too. Hey, I did get one comment coming in from Katie. Thanks for the information. She said, good information. And after my husband had it fixed, our daughter was born. So see, folks, there's a live person telling you that it really works. And it is. I can tell you that, there's some things at your job that really led to a lot of satisfaction. And of course, I was involved in the pre-op evaluation where we discovered the varicocele on exam. I did the ultrasound and kind of proved it. They went in, had surgery. So I saw them for their post-op care. And then lo and behold, they would, send you a note, or they'd call you up and let you know that, hey, my wife is pregnant. Nothing feels better than that. So it's fun to take care of people sometimes, most of the time. With that, I'm going to let you go here because I'm going to get ready for my next show. We'll see everybody next week on UroNurse. Remember to like and subscribe.
So here's to the mornings, the coffee, the monitor glow, to the wisdom he shares and the folks that he knows. Saturday is special when Vic's on the stream with 40 years of knowledge and a head full of dreams.